Hello, I'm Mark Kristoff. I'm in the panhandle of Nebraska. And I'd like to go over a couple of issues, actually the healthcare issue. I was listening to Sean Hannity this afternoon, and excuse me, Rush Limbaugh before that. Sorry, Rush. Didn't mean to call you Obama. Meant to say I was listening to Rush Limbaugh before that, but I was listening to Sean Hannity earlier this afternoon. And I'm not going to get into all the stuff he was talking about, and I took a few notes on some things, and I wrote out some of my thoughts of my own about some things, and a couple of callers had called in. And I had the feeling that maybe some people aren't getting what's going on because not everybody's listening to the radio, and I know there's a younger crowd out there that gets bored easy. Their attention spans may be a little bit challenged when it comes to sitting and listening to the radio, because I can get bored listening to the radio too. It's not a fun thing to have to do all the time, but I do keep myself busy taking notes about what's being said. Now, this is about the bill, about the health care bill that they're working on right now. I don't have every single detail, but under the Obama-Baucus bill, it turns out that 25 million people will still be uninsured. People could wind up, basically, criminals if they are not able to pay for this health care bill. Going to jail over this kind of thing could be very difficult, if not impossible, for some people not to become a criminal, because they just may not have the money to pay for these fees to even have this health care that they're trying to pass. So if it becomes the law of the land, it could be a problem for some people, and even for most people it'll be tough. The IRS will be all over them if they're not paying for their health care through the government funnel. And I knew I named it right when I called it a government funnel, and I heard Sean Hannity mentioned that today. He referred to it as a funnel too, and that's the public option you keep hearing about, or the single-payer system. That's the government funnel. The government, the public option. I call it a government non-option is what it is. It's not an option at all. Once we're on that, we'll be sucked right into that government funnel that everybody and I was talking about before. Basically, what's going on is there's no option at all with that. The only way to reform this is not to pull out the entire infrastructure that we have, which is 1/6 of the economy, 20% of the economy being the healthcare system, and replacing it with something we're not even sure about. Replacing our system with something we're not even sure about. Even the language hasn't made it into legislative language yet. It's still in the conceptual stage. I guess the lawyers are reading it, and it hasn't even been released, and they're already trying to vote on something that's not even a bill yet, practically. You know, folks, how we can combat this situation is with, number one, Sean Hannity mentions it, a lot of other people are mentioning it, tort reform, which means you're dealing with the trial lawyers and hashing out things with them about what's going on with the healthcare system now, and portability, which means you can purchase healthcare insurance policies across state lines. To get into all the other details right now about how much you could save from it, how many jobs it created, it's kind of involved, and I don't have all the particular figures on that, but basically right now what I'm going to say is portability is a good start. The tort reform and portability, those are only two things right there. Only two things. I'll be right back.